Dear friends, there are many misconceptions, misbeliefs, controversies, confusion about constipation and its treatment, because every person has his own way of looking at his bowel movement, and few calling it as a constipation. Now, the very first myth is that if you are not passing stool every day, this amounts to constipation. But this is a myth, because ideally, if you are passing at least 3 stools per week, it is not considered as constipation. Only if the frequency is less than 3 per week, it should be called as constipation in true sense. So many people have a habit of going to toilet maybe 2 to 3 times a day, while few others may be going once in 2 days. Both are normal, both have not constipated, and if this cycle, this habit, this frequency continues and there is no alteration in these bowel habits, then it is perfectly normal, natural. So don't misunderstand that if you are not going to toilet every day, you are constipated. You are absolutely fine. Second myth is that if you don't go to the toilet, if the stools remain inside your intestine, in your gastrointestinal tract, they will get putrefied, and this putrefaction will lead to different type of toxins, poisonous substances, which may circulate in your bloodstream into different parts of your body and can lead to poisoning or multiple side effects or adversities. But it is not true, because till date there is no scientific data, no clinical findings, or no such evidence of this accumulated obstructed stool into your intestine will pose a danger in the form of producing different toxins. So even if they remain in your intestine for a day or 2, they do not produce any harm. Only thing is that more amount of water will be absorbed from them in your large intestine, so they will be more formed, maybe more solid, and maybe little bit dry, so as to pose some difficulty while passing. But otherwise, they are perfectly okay within your intestine. The third myth or misunderstanding is that you can treat your constipation by drinking a large quantity of water. So if you are in a habit, or if somebody has advised you to drink 2 to 3 liters of water in the morning to ace, to trigger, to propagate your stool from your intestine to be passed out, it is not correct. There is no need of drinking so much of water. On the contrary, it is harmful, and it does not have any effect on pushing your stool forward in the form of feces to come out of your anus. Fourth myth is that you should eat lot amount of fibers, which will keep your stool soft and to get evacuated swiftly. It is partly true that fibers do have a role in helping you get rid of constipation or difficult defecation. But these fibers should be supplemented with enough quantity of liquid or water, so that this water or other liquid will get assimilated with the fibers, undigested fibers, form a bulk or bolus of food undigested, which can easily roll out of your intestine and the anus. The next myth is like buttermilk or curd, they are good for relieving your constipation. Again, these two, they contain certain probiotics, which are a type of bacteria which produces a healthy atmosphere, healthy environment in your intestine, especially the large intestine, for the intestinal physiology to act more precisely, more perfectly, to evacuate the stool and to digest the most part of your food. But don't consider consumption of fiber as a lone treatment of constipation. You may be needing many more things in addition to your fiber intake. Again, it is said that whatever you consume, 20% of this should be of fiber. So 1/5 of your food constituent should be in the form of fiber, and it is always better that you consume more amount of insoluble fiber, because these insoluble fibers, they do not get digested, they do not get bind or absorbed into your intestine, and they come out of their own with the same quantity. So if you consume more amount of bran, cabbage, certain beans, nuts, whole grains, which are indigestible or non-absorbable fibers, so they will be passed easily, forming a good bulk of your stool. Another myth is that as your age advances, you will have increased frequency, increased problem of constipation. That is again is not fully true. It is accepted that elderlies and old people have more complaints of constipation, but that is just very natural, because as all your system are getting reduced in their function, your intestinal activity will also be on the same line, and you will have a reduced intestinal peristalsis. But there are so many good number of elderlies and old people who have a perfect stool frequency. They are never constipated, they do get a regular urge, they pass motion very swiftly, softly, without any discomfort, and they are free, cheerful for their entire day, because they pass their stool quite easily in the morning. On the contrary, we find so many number of children, youngsters, teenagers who are suffering from constipation. So it's not true that advanced age is synonym with constipation. So I hope this will help in reducing or eliminating the confusions or controversies related to constipation. And if you follow the right lifestyle, food habits, consumption of adequate amount of liquids, which should not be more than 2 to 3 liters in 24 hours, then certainly you will be free of constipation and will have a more cheerful, happy and peaceful life. My best wishes to you.